Okay. Good morning. May I ask you to take a seat, please, and so we can begin? Thanks. Welcome to the next phase of the Aspen Health Stewardship Project. I'm Franmarie Kennedy of the Aspen Institute, and I will open by thanking everyone for being here, number one. Number two, I also want to thank our sponsors for making this possible, and our board members and our co-chairs and all the participants and the keynote speakers. I also want to thank our 31 coalition members who are also represented here today. I'm going to give a brief overview of the history of the program, and then I'm going to turn it over to Mark Ganz, who's our co-chair, and he will lead us through the next steps. Ultimately, this project has been 3 years in making, and we put together a coalition after we put together 14 thought leaders to really think through sensible healthcare reform. And what they decided in this space was Aspen could do one very important thing, and that is to make a framework for which all sustainable healthcare reform can be based. And that is what we did. It is in your publication. It's the core principles. After that, another important thing we did was to put together the 31 coalition members. And it's those thought leaders that will help us as we move forward. And it is a very important time to be launching the next phase, because this is, after all, a very important time for stakeholders in the policy arena to really address what the federal law will do, the opportunities and the obstacles. And since the implementation is set for 2014, we have very little time, and we are really poised and ready to get to work. And with that, I'm going to introduce you to Mark Ganz, who will lead us through the next steps. Mark?
Good morning, everybody. I'm just going to spend a couple of minutes talking about what's next for the project and where we're going. We had a great board meeting last night and made some progress in terms of deciding which way we're going. As Franmarie mentioned, we've been on this journey since we envisioned the project back in 2006 and 2007. And as one of the founders of the project, it's been a distinct pleasure to help steward such a thoughtful and high-caliber team of leaders from across this country. And the proof is in the pudding, I think. Every time I read the 10 core principles that are in your packet, I'm struck by how thoroughly relevant they are today, particularly in the wake of the passage of healthcare reform, which unfortunately addressed only a few of them. So this is really a testament to the work that lies ahead in terms of achieving a more complete and economically sustainable fix for our healthcare system. On that note, today's event is a kickoff for a series of roundtables and regional events that we'll be hosting over the next 2 years. As our board discussed last evening, we intend to focus on the impact of the law on Main Street and to bring those voices into the dialogue. What's working? Who's collaborating and innovating? How are the intended and unintended consequences of this very comprehensive law working out across the country? Currently, we have 2 regional meetings scheduled and are putting the finishing touches on 2 additional meetings. Our current lineup is as follows. November 18th, there will be a first roundtable discussion that will focus on the Independent Payment Advisory Board. In January of 2011, there will be a second roundtable discussion focusing on comparative effectiveness, research, and innovation. In March of 2011, we'll have our first regional meeting, and that will occur in Raleigh, Durham, North Carolina. The second one will be in May in Indianapolis, Indiana. Then we will have a presence at the Aspen Ideas Festival in Colorado. And then there will be a third regional meeting in September and one in November, those places to be determined, although I'm certainly hoping one of them will be Portland, Oregon, where I hail from. These events will be designed to cultivate top-of-mind awareness of the key principles that will drive smart, sustainable improvements to the U.S. healthcare system with an ultimate aim of helping to suffuse those principles into future policymaking. Beyond discussions about the strengths and shortcomings of the new reform law, we'll focus on other efforts that can and should be undertaken to achieve optimal efficiency and effectiveness in the U.S. healthcare system and how to improve the health of American people. From the beginning, our goal has been to move the conversation toward a more tangible and sustainable transformation agenda and to offer the public a place for the honest exchange of ideas on what is needed to advance innovation and a healthier nation. Today, we're here to launch that next phase. But let's get to it. I'd now like to introduce our opening session. As you can see on the screen, the title of that session, and our keynote speaker is Doug Schoen. Doug has been one of the most influential Democratic campaign consultants for over 30 years. A founding partner and principal strategist for Penn, Schoen, and Berland, he is widely recognized as one of the co-inventors of overnight polling. Doug was named Pollster of the Year in 1996 by the American Association of Political Consultants for his contributions to President Bill Clinton's re-election campaign. His political clients include New York City Mayor Michael Bloomberg and Indiana Governor Evan Bayh, and his corporate clients include AOL, Time Warner, Procter & Gamble, and AT&T. Internationally, he has worked for the heads of state of over 15 countries, including British Prime Minister Tony Blair, Italian Prime Minister Silvio Berlusconi. How did that work out for you? Huh.
That's another panel for another night.
And 3 Israeli prime ministers. He is the author of multiple books, most recently The Power of the Vote, Electing Presidents, Overthrowing Dictators, and Promoting Democracy Around the World. He is a regular contributor to the Wall Street Journal, the Washington Post, and various other newspaper and online publications. He is also a Fox News contributor, making appearances on various news programs several times a week. Schoen graduated magna cum laude from Harvard, we won't hold that against you, and holds a degree from Harvard Law School, as well as a doctorate in philosophy from Oxford University. Please join me in welcoming Doug to the stage.
Well, first of all, let me thank you for the kind introduction and the invitation to be here, and suggest that the presentation you're going to hear today is not only in the spirit of Aspen, really in the spirit of Aspen, the firm that I co-founded, Penn, Schoen, and Berland, and me separately since my leaving. I think both individually and collectively have been dedicated both to the work and principles of the Institute, and certainly Elliot Gerson, who, in addition to being a dear friend of mine, is obviously somebody who has championed and advanced those goals, has been an inspiration for much of my work for Aspen and beyond. And what I tried to do today, the challenge that I took from the assignment really is to try to offer some legislative outcomes. Now, the honest answer to the question is we really don't know what's going to happen. I mean, I'm going to make some clear, unambiguous assertions today that probably won't be completely wrong and almost certainly won't be completely right. And I do that in a spirit of really the volatility of the elections, and hopefully you'll take this presentation as a starting point for your own consideration. And again, if there's an implicit bias in it or explicit, it's that there are ways to improve healthcare to achieve a better result that eschew ideology and put results first. So let me start with the obvious questions. Will the congressional Republicans repeal the Patient Protection and Affordable Care Act? Yes or no? And I don't think there's going to be a repeal. I don't think there are the votes there, though I think there's going to be a vote on it. And I think that's a very important point. When I say, well, you know, it's not going to get through, the Republicans are a minority in the Senate, there would be a veto if it does get through by some reason. But the level of energy and enthusiasm on the right for repeal can't be overestimated. That will drive opinion. And the reason why that's so important is the energy that underscores it will lead them to schedule votes and to do everything possible to reform, reconfigure, and I think weaken the bill. But don't underestimate the degree of energy that will be attached to repealing Obamacare. you know, if you look at the quote I've just put up from Boehner about we've got a lot of tricks in our bag and our arsenal, you know, we're gonna try to do repeal, we'll do reform, we'll defund, we're gonna do everything. And I think that the polling, which on election night showed sort of a 48-48 split on healthcare, really masked the fact that 85% of the people who voted Republican want repeal, and that's what's going to animate the Republicans in the House almost certainly. Take as an indication what Mitch McConnell did yesterday, his reversal on earmarks, as a sign of the power of the Tea Parties. Now, I think what you're seeing here from President Obama is the beginnings of a desire to do some degree of compromise. But I emphasize more beginnings because I don't think the White House and the administration have figured out what it is or how it is either they intend to proceed generally or how they would hope to affect compromise. I think the most likely result will be to try to change or eliminate portions of the legislation, leaving some of the more popular provisions intact. The provisions that will almost certainly survive are prohibiting insurers denying coverage to those with pre-existing conditions, making sure that young adults can stay on their parents' insurance, and closing the donut hole. Here are some of the provisions that will be, I think, targeted. The 1099 provision that requires vendors who they've paid $600 or more for services to report that. Both sides have spoken out against this. The president has spoken against it as well, so I think that there's every reason to believe that that will go. The W-2 reporting provision, again, requiring that the cost of employer-sponsored health care plans be added. Again, there's bipartisan agreement that this was a mistake, differences over how to make up the cash that would be lost if the provision were repealed. But you've had 7 senators who've sided with the Republicans who want to scale back other elements of the bill in response to the lost revenue from repealing this. Again, there's a payroll tax increase that would be phased in over years. Again, how long that will last and in what form, I think, is something that will be considered. I think the other concern that, and again, this is a huge issue that I think for your work is of enormous importance. As I went through I think the very useful chart in the New York Times on Sunday in the News and Review, the largest single possible savings in the health care bill is from reforming Medicare, which, by the way, obviously happens to be the most politically unpalatable way of doing it. Now, one of the ways that was sought to do it was with the Independent Payment Advisory Board, or IPAB, which takes power out of the hands of Congress and has few checks. Whether that will survive in what form, again, is another issue. Now, one of the reasons why the healthcare legislation is not only, according to CBO, deficit neutral, but arguably would reduce the deficit over time, is Medicare cuts. And again, the Republicans ran against the bill, ran against the Medicare cuts, and how that plays out over time, particularly vis-a-vis Medicare Advantage, is another issue that I think we will see litigated. The medical device tax is another issue that arguably makes us vulnerable to providers overseas. Again, there's some Democratic support for repeal, but again, who knows? Now, the other issue is coverage of the uninsured. I've sort of analogized in my own mind this to the way opponents of abortion, and I don't substantively compare abortion to health care as issues. I obviously well recognize the fundamental differences. But in terms of tactics, the opponents of abortion said, we're not going to try to repeal Roe and Wade. We're going to try to do everything we can to effectively make it more difficult to have abortions. And I think in America, and I think they've had success since that decision with that strategy. And what I'm suggesting here, and the reason I make that analogy, is that I don't think that the individual mandate is necessarily going to be repealed in the sense of taking coverage away from 32 million people with coverage, but rather subsidies or expenditures for the uninsured could be slowed, pared back, since expansion really doesn't begin until 2014. How the bill is implemented and funded, I think, is the issue. And then there's another issue, which I'm sure is going to get enormous amounts of attention, which is the insurance mandates, particularly for small business. Will there be waivers for small business? Will there be some more formal compromise? So the first issue in terms of the GOP strategy is, which I define as defund, delay, or debunk, I think there will be an effort to defund healthcare. I think that major components of the law don't go in effect till 2013 or 2014, and I think you can expect the Republicans to do what they can to defund. So the question is how. I think they're going to try to cut the budget for federal enforcement of the laws and the rules. I think one of the things the Republicans have basically said is, look, we can defund federal agencies responsible for implementing the law, such as the IRS or the Department of Health and Human Services. And again, I don't think you're going to have complete cutoffs or shutdowns of the government, but it's possible they could be talked about, and possible that rhetoric could be used to defund personnel that would be involved in auditing or in setting up the law. And I think that's really what could be one strategy. Another strategy would be to tuck definancing provisions into critical bills and make it hard for the Democrats and President Obama to block their passage, like as I said, the Hyde Amendment has been used over the years. To deny appropriations and to basically use them, the appropriation process, as a means of blocking implementation of provisions of the law. And again, I think the idea would be to try to gum up the works and force the Democrats to compromise in ways that obviously they would not want to otherwise. And then to pass other similar provisos stating that no federal money could be used to carry out specific sections of the new health care law. Now, this isn't a lead pipe cinch. I was part of the effort in '95 to delegitimize the Republicans when they threatened a government shutdown and indeed shut the government for a while. And I think there are requirements that much of the legislation, particularly with regard to Medicaid and funding the poor, and subsidies to help people buy insurance, they're not subject to the annual appropriation process, so it'll be difficult to do, which is why the action then turns to the state level. And given, I guess, that the Republicans captured 11 governorships, I think they're up over 30 or 31 by my count, we're in a position where many of the changes that are slated to take effect at the state level will be blocked. One of the things that we are seeing now is a challenge in the courts to the individual mandate. We have the lawsuit. Some think that the suit will have a chance. Others are more skeptical. Time will tell. Others are saying, look, individual states should be exempt from the individual mandate. Others are saying, look, we'll just try to minimize our state's own participation in any expansion of the Medicaid law. We'll minimize state participation for a variety of ways, through funding, through opt-outs, and through not appropriating additional money beyond some designated minimum. The other issues with the state health insurance exchanges, sort of a go slow approach on this, to not move as expeditiously as possible to implement them, force the federal government to come in, or to actually usurp state power. Fifth, there are going to be regulatory efforts to block the bill, a new set of hearings to put scrutiny on the legislation, and basically to raise questions about insurance, the bureaucracy, and the like, to try to, again, slow the measures, funding, and progress through a variety of procedural processes. And if you take the Cantor quote as a summary, I think it's pretty good. If we can't repeal it, we'll repeal it piece by piece, blocking funding for its implementation, blocking the issuance of regulations to implement it. And again, there are a whole sort of set of congressional regulatory matters that allow the Republicans to exercise a degree of oversight to slow down, block regulations, essentially to use the congressional process to slow down or block implementation of the legislation. And the other side of it is, the investigative power of the, particularly the House and Darrell Issa, to again impede implementation of the law. And you'll hear Republican businessmen talking about how they can't hire more workers, they can't afford health insurance, et cetera, et cetera. I think that all of this will have a dampening impact on the ability of regulators to regulate and impact and implement the bill. And the Republican hope would be to lay the groundwork for a broad-based repudiation of legislation that still divides America. Again, I think there's also going to be passage of spending bills to block federal insurance regulations with which they object. Again, another contentious issue before the Congress. Now, I think the Republicans have been very clear in what they themselves want to do. The question is, what do the Democrats represent? What do they want to do? And I don't think there's really, any clear Democratic message that has likely to come forward. Some patient groups are going to focus on implementing the law. Others are going to, use the law as a electoral vehicle for 2012. One of the other ideas is to seek, as the president said, some degree of compromise, take those aspects of the bill that are popular with Republicans, try to sell those in the context of both compromise and selling the benefits of the law. And again, I think that when you look at the rhetoric back and forth, the president says, we'll compromise. Harry Reid says, do they really want to roll back provisions on insurance reform, on the donut hole that are popular? We have a position now that the Democrats find themselves in with an unclear, uncertain strategy. Again, there are issues about what are we going to do about Medicare reductions, which are in the bill. How do we lock in funding for expansion of Medicaid and federal subsidies to help people buy the private insurance the bill talked about, which doesn't begin until 2014. Then you also have, as another issue, and again, it's almost a separate issue for a separate day, is how do we affect the $4 trillion reduction in the federal deficit that the Bipartisan Deficit Commission of former Senator Simpson and former Chief of Staff Erskine Bowles have talked about. They've recommended payment reform, cost sharing, malpractice reform, long-term measures to control health care. How that will play out is another issue, what the White House will say there. Obviously, Nancy Pelosi's immediate reaction was that it was unacceptable, dead on arrival. There was some softening of that position after its first presentation. The Republicans have been somewhat more positive, but again, people on the far right, like Grover Norquist, have said it, even though tax rates come down because of the home mortgage deduction and charitable deduction go out, this is a tax increase. So who knows what will be the result of this, but it certainly does contain trimming programs like Medicare and Medicaid. But you'll see that there are issues on cost sharing in Medicare, reduction in spending on Medicaid, rebates for brand name drugs as a condition of participation in Medicare Part D from the pharmaceutical industry. So again, we have a variety of reforms that have been driven. I think there are a number of things that can be done, and I think here we get back to taking Democratic and Republican ideas, putting them aside and saying, okay, what can we do to reduce federal health care spending? How do we do this in a way that makes sense? And I think one of the things that can be done is a focus on the issue of chronically ill patients and an approach that focuses on diseases like type 2 diabetes or Alzheimer's rather than on specific programs per se, to try to replicate a coordinated care model so that we will achieve consensus in treating disease rather than creating political mindlessness. The whole issue of IPAB reform and how we deal with chronic diseases is another issue that's been raised. How do we have integrated delivery systems that some insurers are testing before? You know, the whole notion of how do we deliver healthcare services more effectively in a growth-oriented way, reduce spending, open job and employment opportunities for healthcare professionals. How do we transform the model of care to better promote innovation? How do we focus on greater research and development, strengthening the FDA, prioritizing science, technology, and math? Basically, how do we focus on chronic disease, innovation, and saving lives in a way that will ultimately save money and offer us better health care? And there have been studies that have been done that suggest that there are ways to do this through research and innovation and technological gains. Hopefully, we will have dialogues like the one that Aspen is now promoting and has been in your study group, something that I've been able to participate in, I'd say directly and indirectly over the last 3 or 4 years. What I would conclude from this is, and I went through it quickly, we have a range of issues on the table. For those who would say healthcare has been decided, or there's a clear agenda, or there's a clear approach, would be profoundly wrong. Everything is back on the table. What will happen, we just don't know. And I would say this couldn't be a more timely or useful process for a political leadership, as I spent the better part of, I don't know, a week or so trying to prepare, figuring, as David Johnson and Elliot Gerson would tell me, well, if you just study hard enough, you'll figure out the answer. And the answer, as I figured with more and more time, is there really needs to be more and more effort from groups like Aspen to inform the process. Otherwise, we will all suffer as a nation. Thank you very much, and I'm happy to take whatever questions or comments there might be.
I have a question, or I'd like to take a first question. I'm Linda Carnes, by the way. To everybody.
Yeah.
Please.
Just a very quick question. You didn't speak at all about the High-Tech Act and the stimulus funding for electronic medical records. What's your sense of the political environment around that funding?
You know, it's a fascinating issue because a few years ago it was much more in the news, and I thought it would be a done deal, and it should be a done deal. And I guess what has surprised me is that it has gotten less currency, less attention, and less prioritization, because I think it's the sort of thing that can do what I was trying to talk about, which is to streamline the process, save money, and improve outcomes. So should happen. And again, I would sort of say it's incumbent on those who see the logic behind it to push it to the fore again so that it doesn't get ignored.
2 questions, if you don't mind.
Please.
One has to deal with pandemic preparedness and emergency response funds. What do you see the future of that? Because there was a lot that was earmarked or designated, but that is some of the funding that could be in question when you get through the appropriations process. So I want to talk about that because I think that was galvanized after H1N1 and, of course, just the fear of multiple pandemics, swine flu, you name it. The second question has to do with the impact of the states and what's going to be happening at the state level now post-election and its impact on how the federal law will be shaped.
Yeah, let me start with your first question and give you what I think is a discouraging answer. I think in this environment, in the hyper-political environment we're in, the kind of coordinated response that pandemics should produce are likely to fall by the wayside. That would be my guess, and I would hope that I'm wrong, and I would be pleased to be proven wrong. And I think the theme of my concluding remarks today, which I admittedly moved through relatively quickly, is that is precisely what we need to push to the fore, because unless we focus on outcomes rather than process, we lose the American people. I think one of the things that I should say about healthcare, which goes back to the bill, and I say this as somebody who probably would have supported myself a more modest bill than the one that was passed, is what the mistake the Democrats made was by focusing on outcomes in terms of the legislative process rather than results or benefits to people or benefits to the system. What happened is that swing voters decided we just don't like this. We see the cost, we don't see the benefit. And my sense is with the range of outcomes that could be cataclysmic in America, you cited certainly some, but not all of them, if we focused on them, not to scare people, but to suggest we as a nation have an obligation to stand ready to assist, I think we'll do a better job getting funding set aside. The second, I think, is and again, it was a theme that I touched on in my talk today, but by no means covered completely. My sense is that the Republicans have figured out with, 31 odd state houses, that they can do an enormous amount of good for their cause or arguably create problems for those who want to expand healthcare at the state level. And I think that an enormous amount of energy and time is going to turn to the states, like, for example, on implementing the state-run insurance exchanges or not implementing them, or blocking Medicaid fundings and the like. And I think that what we're likely to see is a degree of obstructionism, state by state, that will make implementation over the next couple of years of healthcare that much more difficult.
Please identify yourself.
Okay. My name is Svetlana Rykhova-Tibets, and I have a medical education from the Moscow State University. And 3 years and a half, my American husband was sick. He had a stroke. That's why I know the Washington, D.C. medical system very well. And my conclusion that I know exactly strong and weak sides of American system. And I wanted to write a letter to President Obama because I saw people, for example, the surgery could be perfect, but the last level of service, for example, technicians, because I saw their work, they are paid not too much, but their work is very important because it is the last stage of care. But to my mind, they're not paid well. Then they have too many functions. They serve the meals. They have to turn around the patients. And for example, my husband died in December, the 12th of December. And the last mistake for this reason was that he was not turned around each 2 hours. And wound care, to my mind, they could cover wound, but it is necessary to have the schedule of turning on wounds. That's why I ask everybody who is connected with the medical problems to pay more attention to very simple people on the last stage of the medical service. Thank you.
First, let me obviously express my concern, I'm sure that of everybody in the room, for a profound and horrific mistake that was made. And I would, if I can just take the prerogative of being a speaker and to go beyond your comment, which obviously is deeply personal and reflects a grave weakness in our system. And one of the reasons people are so cynical is that the tragedy that befell you befalls more people, leading to people saying there's vast inefficiency, vast waste, and vast incompetence in the best medical system in the world that lets people die needlessly and die without cause or not get the care they should. Clearly, there are all sorts of problems in our system, and one of the reasons why there is such a disconnect in this country is really what I was trying to speak of, the disconnect between people who are looking for outcomes and a care-based system that focuses on outcomes from surgery through to recovery, as opposed to, you know, when you talk about, well, we're going to plug the donut hole and we're going to provide 133% of the poverty level in coverage and make sure that everybody has health care. You know, people sort of say, what does that mean? How does that have any relevance to my life or that of my family trying to get health care? And I think that groups such as this can, again, do much to address the tragedy, and it's a horrific tragedy that befell you and your family. And I can only say I hope that the result of this effort and other efforts is that our system works better. So thank you, and my sincere concern.
I think I can only take one. This session has to be truncated because he has a 9 o'clock taping. I'm sorry.
Doug, David Johnson, fellow classmate.
I remember well.
CEO of BioCrossroads. I'll be actually talking in a moment on the Health Information Technology panel. But our organization is made up of a couple of sponsors, such as Medco and Lilly, some of the large healthcare providers, and other corporate headquarters device companies in our Midwestern region, in our case, Indianapolis. And most of the private sector members of our coalition spent a great deal of time, money, and effort trying to figure out the last version of healthcare reform. Not all of them love it. Certainly device companies hate the medical device tax. But for most of them, they want to get on with it. They basically want to know what the rules are, try to figure out what they are, have a stable playing field, if not a level one, and move ahead. Is anyone giving any thought beyond all the politics of this to the fact that the different industries and coalitions that came together behind healthcare reform a couple of years ago may come back again and try to keep the thing the way it is just so they can have stable rules of the game going forward? Because I'm not hearing much about that.
No, a fascinating point, because again, as I went forward to try to put together as thoughtful a presentation, David, as I could this morning, I could read volumes about how the Republicans want to obstruct it. There was less about what the Democrats wanted to do, but it was basically stay the course, implement the bill, not so much move on, but almost relitigate. Let's keep fighting. And the notion of, on one hand, patient-centered outcomes, or the flip side of that is move forward to implement in a logical way so business can do what it does, is really not being discussed. And I think that message you're articulating is one that grows out of the both the logic of this group and also the logic of the situation. So I would think that it makes good sense, and the polling that I've done suggests that the American people see the clear logic in that position of that argument.
Doug, I'm sorry to interrupt you. Thank you so much,
you so
because
much.
we've promised to get you to your
Yes.
taping.
I
I know there are a number of other questions in the room. The next panel will have an opportunity to kind of continue this, so you'll still have a chance to get your questions in. Thank you very much. Thank you.